right, so let's, I know it's been a long day, so I'm going to go through these quickly. This is my usual presentation. The slide on the left side is our last Board of County Commissioners meeting, and the one on the right side, just so you can see the increase of almost 3 million new cases since October 25th, and the deaths, just for perspective of where we are. This is the U.S. curve, and you can see that our curve here continues to go up. It appears that for this year we have the three peaks. The first one on April 9th with 34,000 cases. We thought that was a big number. And then after the 4th of July, we had the July 16th where we reached 77,362 cases. And now every few days it seems that we have a new high. On 11/23, we reached the first time that we had reached over 100,000 cases. We had 123,056. And then 10 days later, we reached this peak with 177,022 cases. So my concern is what I see with this spike. What do you all see when you see this versus these two? Well, I'll cut it short so we don't talk too long, but these are more curved, right? And as we reached the peak, we started coming down, we opened, we started coming down, we opened. This one is going what we call exponential, straight up. This line has no curve to it. So hopefully this will be the end and we'll start seeing these coming down. A couple here have. But this could continue, especially through the holidays. So I'm very concerned of the holidays. I'm very concerned that so many people are going to be traveling. So we have to keep all those things in mind. And people will be traveling here as well as going out. Yesterday, the phone lines were very busy in the testing because everybody needs a test before they take the flight on the airplane. So that means a lot of our residents here in Palm Beach County are going to be traveling up north where the states are in real critical conditions. So these are our cases in Florida at 889,864 total cases. That's 4,663 new cases versus the 3,377 that we had at our last meeting. And the hospitalizations at 52,019. It's an increase of 119 new hospitalizations versus last time we only had 74. And most importantly, the total number of deaths now is 17,559 versus the 16,000 and a half that we had last time. And unfortunately, that's 41 new cases versus the 20 that we had last time. So these numbers are going up. The positivity for Florida has also increased. The daily positivity, which should remain below 5. That means if it's at 5, that we're stable, that we can do effective contact tracing. Anything above that, then you start having community-wide spread. The total positivity for the state now is 7.92, and we have most of our states are reporting alarming increases, especially in the Midwest. So there's quite a bit of alarm in terms of cases going up. As you can see before, the last positivity was 5.91 for the state. So the numbers by the counties here, we remain in third place, and proportionally we've been staying pretty much the same, and then followed by the 5 metros, Dade, Broward, Palm Beach, Hillsborough, and Orange, and then Duval at 38,000. And then I always put up Collier and Martin because of the proximity to us and how important they are in terms of our relationship around the work around the lake and the transportation of farm workers and other kinds of workers that travel this route on the west part of our coast, going up to Martin County, St. Lucie, and coming down and sometimes going into Broward and Dade. So these counties have remained pretty stable in terms of the increases going up. And we have 358 new cases as of yesterday, 11 new hospitalizations, and 5 new deaths. So Our numbers reached all the way up to 700 we had one day. Luckily, we were anticipating this, and we have taken actions to make sure that we can keep up with all this. As you can see here, comparison from our last Board of County Commission meeting that we had this map versus this one. The main difference here is that you see the Henry County here has changed colors, so there's more dark colors. This county here is Henry, and this one is Osceola. So these are, but especially my concern is up here around the Panhandle and all this area turning darker and darker. I agreed with Dr. McKinley, there I go again, Commissioner McKinley, who observed that these are very poor counties and a lot of underserved people around here. It is very, very difficult for these counties to keep up with the virus. They do not have the resources at all that we have here in Palm Beach County. We're very fortunate to have a very strong department, a very good relationship with the county. That's not true in all our counties around the state. So these counties are really struggling. The census tract is something that we've begun to give, especially to the municipalities, so they can see their increases instead of the old map that just showed how many total cases we had. This is from our last time, and as you can see, we've got more darker in the 14 to 23 numbers around, especially around the west part of the county, as well as in Belle Glade. It's gone up one level from 6 to 7, it's gone up to 8 to 13. It's not a lot of new cases, but you can definitely see the switch in terms of those new cases that are coming in where they're being located. And the municipalities then work with our emergency management division, and they are able to send the testing units, the mobile testing units out to them to help test the individuals. So the real presentation is right here on these next two slides. At the last Board of County Commissioner meeting, we were preparing to increase our contact tracers despite the fact that the state ended the funding in November. We're getting ready to look for this second peak, and so we've been prepared to hire more folks. We lost a lot of our contact tracers because they went back to school, and so we've had to hire more. Our contact tracers are doing a really good job up to now. They've been able to keep good communication with the people. Our community outreach workers that the county hired has helped us tremendously in terms of getting people to know the right information to give us and to expect our calls. So thanks to all that we've done, we were able to handle the 730 cases that we got the other day unexpectedly that we got on the 14th. That's that big spike there that you see, 730, right there. But our numbers have definitely been going up. So I always look at 3 weeks to get a nice trend line. We were at 332 averaging per day, up to 377, and now we're about 415 cases per day. So who are the people getting infected? To me, that is very important because that guides us as to what we have to do to try to contain this spread. It has been consistently the same age group, the age distribution. That's the chart I get from the county report that's available on floridahealth.gov. And that age distribution shows us that the 339 new cases, this column here, is made up of 50% of the 15 to 44-year-olds, okay? It's this group right here. That's the group that we're having a lot of concern. That number has been going up above 50% several times. And where are they becoming infected? That's a key question, right? Because that's where we need to focus in on. They're getting infected in bars and restaurants, clubs, house parties. And some are getting infected even at family gatherings, weddings, and birthday parties. So for several months that has been true, and that's one of the things that we did when we put in the mandatory mask order and we realized that without enforcement, our orders were useless. We've been very fortunate that most of our citizens have embraced their civic duty to promote public safety for other folks as well as themselves. And those who have been immunosuppressed or the elderly that are higher risk have been very careful, and they've been staying home because you don't see a lot of deaths occurring in this group. These have remained pretty steady, right? So this is where the big bulk is. You see very few, only 4 new cases here in the 85 plus, 13 cases in the 75 to 84-year-olds, 37 cases here. And these do have hospitalizations, but they have not been dying. Okay, these numbers are pretty flat. One of the things I'm going to do going forward is to go ahead and by running our report of deaths, I'm going to try to replicate. I've asked the state to do this, to put the new cases for the deaths and the hospitalizations. The hospitalizations will be a little harder, but I think I can do the deaths so that we can see who are the people that are dying, where they're coming from. So basically, this to me says that we need to get active and we need to maintain all the COVID precautions, namely the mask wearing, the 6 feet distancing, the hand hygiene, cleaning of touch surfaces, and avoiding the 3 C's. And those are closed-in spaces with poor circulation, crowded spaces with large crowds, and close contact spaces where it's hard to maintain distance. Every time we've had a case, those are the places where this group has been congregating. And the majority of the cases are all fit into those 3 C's. People that, or whether it's fatigue of COVID, we all want to go out, we all want to get together with friends. It's very hard to continue this, but if we're going to keep these numbers low, we need to do it. The other disturbing trend is our daily positivity rate. Our goal now, which is the gold standard of the 5% positivity, that is no longer just Dr. Alonso saying that. That's been shown that that's the number that you need to be able to maintain the ability to do the contact tracing. We were only at 4.62 one day out of these 3 weeks, okay, on November 5th. On the 15th, we were at 10.4. On the 13th, I'm sorry, okay? That's the highest we've been since August. And I will tell you that our positivity rate that hasn't been published yet has gone back up when it gets published today. So we have a lot of work to do. We do not have to reinvent the wheel. We have proof that our COVID education and enforcement team works. We have solid numbers to show that it works. And most importantly, we can do it while maintaining our businesses open, but safer for the public. We did it before, and I strongly recommend that we act now before this window of opportunity closes on us and we end up spiking above that 10 and then makes it very, very difficult to come back down. The question that we will not be able to answer as these numbers go up is when we ask the question, who are you in contact with? Once we have community spread, once it reaches above 10 and we have wide community spread, that question cannot be answered. And so therefore, it is critical that we be able to keep those numbers down. So I'm going to keep up this slide as long as it's there. We need to mask up, leather up, and roll up our sleeves to get the flu vaccine if you haven't gotten it. It's very important that you do that. Avoid the 3 C's, like I said before. And finally, I want to end up on a good note. The fact that we now have not only one vaccine that is very promising, we now have 2. Pfizer has about a 90% efficacy, and the Moderna now has a 94% efficacy. The interesting and the very useful part of Moderna versus Pfizer is that Moderna went ahead and put that little messenger RNA, that little piece of RNA, that messenger RNA that they're going to put in there that's going to replicate those spikes in your body. They put it to become more stable. The Pfizer vaccine is very unstable. That's why it needs to be refrigerated at minus 80. If you've done the math, that's minus 112 degrees Fahrenheit. That's pretty cold. They say they can be minus 90, I don't know, minus 90, minus 112. You need special refrigerators for that. They're very expensive. We've been concerned about how to handle this vaccine, so it has to be used up right away. The Moderna vaccine stabilized that little piece, that messenger RNA, in a microscopic piece of fat. And that's what goes into your body. So that can be maintained at a regular freezer, freezer at minus 4 degrees. And that will make it, can be stored there for 30 days. That makes the distribution of this vaccine much, much more useful and much more practical. So we're very happy. There's 6 other vaccines. The problem now is going to be the production. Once this gets FDA approval, the studies are still going on. So once that happens, it'll be the distribution and the making of the vaccine enough for not just the United States. These vaccines are going to be distributed throughout the whole world. We're specifically working with India to get the vaccine over there. So it's going to be a process that's going to be in phases, and probably the estimates is that for the general public, after they do the seniors, the healthcare workers, and the first responders, the general population would probably, if things go on track, be available around April. So that's good news. It's very exciting. This is a revolutionary process for vaccines. So you're in the middle of experiencing something that's never been done before. It's going to totally change how we do vaccines. I'm open for questions.
Very good. We'll start with Vice Mayor Weinroth and move to Commissioner Weiss.
Hello again.
Got that. Obviously, vaccines without vaccinations aren't going to work. So it's going to be incumbent upon our stakeholders to feel comfortable with these vaccines that are coming up. So I'm assuming that there'll be a great deal of work to ensure that the residents are going to feel comfortable with the quality control and with the process of testing these and approving these. So, I look at these numbers and they certainly are frightening, but I take some, I see that we are not as bad as we could be, and I'm only looking at the fact that positivity rate back in October 26 was 8.29, and that certainly was a peak, but we're now at 7.55. So while the number of people who are testing positive in gross has gone up, things are somewhat stable as far as the positivity rate, and that's at least a good sign that we have some control, not the kind of control that I think you're looking for, but
Definitely not.
yeah, but I think we have some control. My concern is I've heard that we are starting to close some of our testing centers. Specifically, I heard that we're going to be closing the center down in South County at the Palm Beach Civic Center, or which ones are we closing? Or Town Center, I'm sorry, Town Center. And that gives me some concern. And way in the beginning of this, we had discussed Town Center, and I understood that that might be an issue, certainly as the shopping season is starting to heat up. I'm sure that they're hoping they're going to have more shoppers, and so that they don't have the space down there. But we need to be making sure that we are making these test centers accessible and that we are doing the contact tracing. And my question to Madam Administrator is, what's happening with the application that we had invested in? Is that being embraced by our stakeholders? Is that giving us any positive control over the spread of the virus? How is that working?
The Combat COVID application is growing. We've enhanced our marketing efforts, and some of us may have seen the advertisement on the television, so we're going to be monitoring and tracking to see how effective that advertisement is on getting people to sign up for the app. I strongly urge anyone listening to please sign up for the app so that we can continue to monitor this virus and protect ourselves. And it's going to take individual efforts for us to keep this spread or try to prevent the spread from escalating higher. But that COVID combat, it is definitely an application that we're growing here in Palm Beach County and Miami-Dade.
Thank you. And just to, again, highlight another number that at least is staying stable, the mortality rate has stayed stable throughout this as far as any death is one too many, but at least our healthcare workers and doctors have figured out once someone is of a situation that they have to be hospitalized, the care that they're giving them, from what I'm seeing, these statistics demonstrates that they're able to manage the disease and its complications. Is that your understanding, Doctor?
Bill has some more graphs that will outline that graphically.
Okay, well, then I'll wait until Mr. Johnson makes his remarks. Thank you.
Very good. Commissioner Weiss, you're recognized.
Thank you, Dr. Alonso. Couple of questions. Can you, as we're getting ready, we have holidays coming up next week. What's your recommendation to our residents on how or what they should be doing to stay safe this year?
Well, the recommendation that I've given to my family is to maintain only your local family members that you are dealing with on a daily basis. It's not the time to ask for Uncle Joey from Wisconsin to come visit. We need to keep it small enough where you can maintain the 6-foot distancing, especially from people, even if they're your own family. If they're coming from the outside, you don't know. My son came to visit. He quarantined himself for 14 days before he came to visit. God bless him. And he was very concerned the whole time for me. So I really appreciate it for a 20-year-old. That's pretty amazing behavior, and I appreciated it very much. So we need to be very careful if we're going to travel. The other day, like I said, the phones were ringing off the hook. They had 29 people at the healthcare district answering the phones, and they couldn't keep up with the calls because everybody needs a vaccine to go travel. And so that means that a lot of people are getting tested. That they need to get tested to go travel. And so that means that a lot of people are planning to leave. So you're going to take a look at where you're going and be safe, maintain your mask on in the airports. You got to be very careful with what they hand you when you exchange money or credit cards. That's a touch place that you may become infected, so be very careful. Constant washing of hands if you go anywhere, and be careful where you go and who you're seeing.